Hi, you guys. Welcome back for another Work It Out Wednesday. We're doing Work It Out Wednesday all month long as we do our practice question series. And this week, we are getting all into the derm, musculoskeletal, psych, and men's health. And if you haven't had a moment, go check out the last couple of weeks where we have covered 8 other systems of practice questions. Okay. But let's get into today's questions. Question number 1 states a patient presents to the office today with complaints of pain to his right foot. He states that he dropped a pot of boiling water on his foot. As the nurse practitioner assesses his foot, she notes 2 blisters. And based on these findings, what type of burn should the nurse practitioner document? Is it A, a first degree burn, B, a second degree burn, C, third degree burn, or D, a full thickness burn? All right, take a moment and tell me what you got in the comments, you guys. All right, you guys, I always tell you to read the stem of the question first to ensure you are answering what is truly being asked. So the stem of the question states, based on these findings, what type of burn should the nurse practitioner document? All right, so what do we have here? The patient came in complaining of pain to the right foot, states that he spilled boiling water on that foot. The nurse practitioner notes blisters to that foot. So you need to start thinking of how the presentation is for the different types of burns, right? So, we have our first degree, our second degree, our third degree, but do you know those full presentations, right? So, first degree burns, it wouldn't be that, right? Because, yeah, that has some redness, um, but does it have blisters? It doesn't have blisters associated with it. It does have some redness, some associated pain. So, no, we can exit out that first degree. Second degree, that should have been your first thing because blisters are one of the key identifier for a second degree burn. Blisters, redness, that the pain, and also, bulla is the medical term for that blister, that fluid filled area. So if you see bulla, also that's common for second degree burns. Okay. So, and then third degree, that's where they had that full thickness. So C and D would have been the same thing. Question number 2 states the nurse practitioner suspects her patient has a meniscal tear and is instructing the nurse practitioner student on how to complete the McMurray's test. What instruction shows the NP's understanding? Is it A, hold the knee with one hand and hold the foot in the other hand? Bring the foot inward while holding the knee stable. If positive, you will hear a click. Or is it B, hold the knee and bring the knee to the patient's chest? C, support the knee in one hand and raise the patient's leg 90 degrees? Or D, support the knee in one hand and rotate the patient's foot at the ankle with the other and listen for a click? All right, you guys, take a moment to tell me what you got in the comments. All right, the stem of the question states, what instructions show the NP's understanding? So we're trying to see if the NP is instructing on the McMurray's test appropriately, right? So A says, hold the foot with one hand while holding the foot. I'm sorry, I said the same thing twice, right? Hold the knee with one hand while holding the foot with the other. Turn the foot inward while supporting the knee. And if you hear a click, that's positive. Y'all, that's McMurray's test all day long, right? You're going to support that knee with one hand, holding it with one hand. Take your other hand and hold the foot and bring that foot inward of the injured knee, the complaint, the painful knee that they're complaining about. And you will hear a click if it's positive. And I mean, it is very apparent. You will hear it. All right. Question number 3 states the nurse practitioner has diagnosed a 40-year-old patient with major depressive disorder. Which medication would be the best first line therapy? Is it A, Nardo, B, lithium, C, Elavil, or D, Zoloft? Tell me what you think in the comments. All right, you guys. So, what medication would be the best first line therapy? And we are talking major depressive disorder. So, you need to know your medications as well as those drug classes. This is where it's common, you need to know both because if they just give you the med name, you need to be familiar with which one, right? So, would it be A, Nardil? No, although that is a treatment option, no. MAOIs are not your first line therapy, right? But you can utilize those. B, lithium. Lithium is a mood stabilizer, better utilized for things like bipolar, right? C, Elavil. Even though you can, that's a tricyclet. We're looking for the best first line therapy. Again, just like Nardil, we can take that out. And D, Zoloft is an SSRI. We know SSRIs are those first line therapy for our depression. And then lastly, this question states the nurse practitioner is explaining a men's health condition that is an emergent case to the nurse practitioner student. Which diagnosis is considered emergent? Is it A, BPH, the benign prostatic hyperplasia, B, epididymitis, C, testicular torsion, or D, CPH? Tell me what you got, you guys. All right, so the stem of the question states which diagnosis is considered emergent? So the nurse practitioner is explaining a men's health condition that's considered an emergent case to the nurse practitioner student. So we're trying to see which diagnosis is actually considered emergent, right? So A says benign prostatic hyperplasia. No, it's benign, it's not emergent, right? B, epididymitis. No, although it's bad, it's not emergent. Although you do want to take care of it quickly, it's not emergent. And even if you were stuck, let's hold on to that. So, in cases that you didn't know on a test question, just hold on to that one. C, testicular torsion. Off the bat, you should know testicular torsion is emergent. You know that if you don't get them referred and surgery is done, that can lead to necrosis, right? So testicular torsion C is the answer. That is the emergent case. And the last one I just made up. So yes, C, testicular torsion. Familiarize yourself with those because you definitely need to know what are emergencies, right? All right, you guys, that is it for today's questions. As always, please be sure to like, comment, subscribe, and share with whomever may find this beneficial as well. But be sure to meet me back here tomorrow for another day of our practice question series on these 4 topics. And then next week we'll be hitting 4 more, okay? All right. Bye, y'all.